As part of the National Patient Experience Survey, information about medications on discharge was identified as an area for improvement. Currently, we have pharmacists linked with all of our medical and surgical teams, and those pharmacists are available to give information to patients about their medications on discharge and answer any queries at the request of the patient or the medical or surgical team or the nursing staff, and this is outlined in the patient information guide. We also give information to patients if they're being discharged on certain medications like high-tech medications or unlicensed medications, as these often need special prescriptions, or community pharmacies need to be alerted about these medications in advance so that there will be a supply available for the patient prior to their discharge. If a patient is started on a high-risk medication like a direct oral anticoagulant or warfarin, we will provide information and education to patients about these medicines before they go home. We have recently updated all of our patient information leaflets in the hospital. So we have information leaflets that describe the different health schemes, so the drugs payment scheme, the high-tech scheme and the long-term illness scheme. And we also have information leaflets about patients being discharged on medications for TB or post-splenectomy, where patients need to be educated about their vaccine schedule and antibiotics. We completed a pilot of discharge medicines reconciliation in early 2020 of this year, where senior clinical pharmacists will build the discharge prescription for complex patients, so patients who've been in hospital for a period of time and have had lots of medication changes, and then the discharging doctor will review that prescription. And we're hoping to roll that service out widespread in the hospital over the next few months.
Here in Tallaght University Hospital, as with other all-acute sites, we have been made aware of the results of the National Patient Experience Survey. One of the areas that was mentioned in this survey in need of improvement was the area of communication in healthcare. What we have done to address that here in Tallaght University Hospital is we have fully embraced the National Healthcare Communication Programme, which has been developed in association with the European Association of Communication in Healthcare. This is being rolled out in an Irish context under the auspices of the HSE National Workforce Planning and Development Unit. We have a number of trained facilitators for this programme. This is a modular-based programme, 4 modules. To date, we have put over 120 staff through modules 1 and 2, which are making connections in healthcare and developing good rapport in communication. In order to facilitate socially distanced communication and communication workshops, we will be rolling out virtual workshops to address the area of staff communicating with patients and families whilst wearing personal protective equipment, which is more and more prevalent in these pandemic times. What we will also be doing is we will be addressing the area of telephone communication, breaking bad news by telephone, developing rapport by telephone, and responding to strong emotions by telephone. These are all areas in need of improvement, which we will address via the National Healthcare Communication Programme.
The hospital have developed and implemented this simple patient information guide that is given to patients on admission to our hospital. It is a simple booklet that will ensure the patient is engaged and fully informed through their journey here in our hospital. This booklet clearly outlines the uniforms of the people playing their part in caring for patients in our hospital. We are aware that patients have a confusing time while they're in hospital, and this simply outlines the uniforms and the colours of the uniform. Good nutrition is essential for patients here in their journey through Tallaght University Hospital. Food is an important part in a patient's recovery, and this booklet simply outlines the special diets and the times of delivery to their meals on each ward each day. Restricted visiting during COVID-19 is essential here in our hospital. The Patient Care Package Delivery Service is a designated service that is given 3 times a week for patients and their families to deliver care package services. However, virtual visiting is essential, and we have ensured that iPads are implemented in all the wards to ensure patients and families are able to communicate on a daily basis when they're here in our care in the hospital. Clean Hand Save Lives is a part of the booklet which is essential during COVID-19. It ensures that the patient can be actively involved and engaged when they're here in our care in the hospital. This booklet outlines the patient discharge information and is very useful for patients and their families on the day of discharge. Your discharge plan will be discussed on a daily basis by your clinician and the nursing staff. You may have questions that you would like to ask your clinician or nursing staff on home, and this simple template at the back of the booklet allows the patients to document any questions that they can ask their clinician or nursing staff on their day of their discharge.